Hey guys, Dr. Watt from Pinecrest Chiropractic. Let's talk through 3 of the most common shoulder injuries that we see in office. The first one that we see a lot is people talking about their rotator cuff, right? So we've got visuals up here. Your rotator cuff isn't just one muscle or one ligament. It's actually a group of muscles. 4 muscles specifically. Most people refer to them as your sits muscle as an acronym to help remember them. The supraspinatus, which is right up here over top of the spine of the scapula. Your infraspinatus, which means it's right below it. Your teres minor, which is going to come off the side here and over to the humerus. And lastly is your subscapularis. These 3 are all looking from the back side. This one's looking from the front side. It's going to be deep on the front of that shoulder blade. So that's your subscapularis. Those 4 muscles, all 4 have a really important job with helping the rotator cuff. And so what it does is it helps the humerus hold in the socket, right? So the ball in the socket. That socket's really, really shallow. And so when that humerus goes to roll, it can actually roll out of or create impingements with that motion. And so those 4 muscles are responsible for holding that in place and holding that socket where it should be. Super easy to injure one of these muscles if you don't have good stability around there. So this is the first thing we see. Another one that we see quite often, the second one, is going to be something called a frozen shoulder or adhesive capsulitis, right? And so that sounds pretty daunting, and it is, right? And the shoulder does exactly what it sounds like. It freezes, right? And so the capsule is going to be that little bubble around the joint. Every single joint has one, but for your shoulder here, when it gets adhesions or adhesive, right, it's going to stick together, and all of those things are going to stick together. Now, it's not just there. Oftentimes, it presents out into the muscles as well. So those sits muscles we talked about, or we have patients with their upper trap, and these patients are going to present feeling like they can't move their arm. This is not spontaneous. This doesn't happen overnight. This is usually a gradual progression that gets them to where they're at. Oftentimes there's an injury to start off with, where it could be something like a bursitis or something else, but it progresses to this point where it feels frozen and stuck, and these patients can't lift their shoulder up overhead. They can't move it forward. They're stuck in all of those different ranges of motion. So frozen shoulder is something that we see quite often in the office, that we need to melt or blast away those adhesions to get it to move like it should again. The third thing that we see a lot of, I lumped it into one category, and these are going to be your itises, right? Now these are big ones, and we could dive down into each one, but itis only means inflammation. Simple as that, right? So when we have a bursitis, your bursa is inflamed. We have a tendonitis, the tendon's inflamed, right? We have arthritis. Arth means joint. The joint is inflamed. It's that simple, right? Now, these things don't usually happen as the sole reason, right? You don't get a bursitis strictly because the bursa is inflamed. You get bursitis because you have improper motion or poor stability that then presents with that tissue failing and screaming at you. Same thing over here when we get a tendonitis. In a previous video, we talked about how there's 17 different muscles that attach to the scapula. Any one of those tendons can become inflamed and then have a tendonitis or a tendinopathy. And so those things happen oftentimes from improper loading or progressing the load too quickly. The third one, arthritis. This one isn't a short one. This is taking a long time to earn that one, where the bone literally starts to deform and change, right? You're putting extra calcium there to try and protect it. That's what your body's doing and creates this arthritis. So all 3 of these things can get treated when we restore the motion back through the joint again, work on the stability and the movement around those joints to get them functioning like they should again. So those are the 3 big things we see in office. We have the itises that all happen a lot. We have the adhesive capsulitis. There's the itis word again, but frozen shoulder. And lastly, it's going to be that rotator cuff type injury. All of these things respond really, really well to chiropractic care. And we treat them through different types of exercises you can do at home using shockwave, laser. You'll see some of that stuff in some of our other videos, but all are different ways that we attack the shoulder, get you back doing what you need and want and love to do again. But if you got more questions about these or want to chat more in depth, come on in. Let's chat about it.